Good morning, everyone. It's a pleasure to have you all here for panel discussion on leveraging IoT and digital engineering for innovative business model. And I'm Dr. Rupali Srivastava. With me is Mr. Shiv Kumar Gopal, and he would be leading the discussion. So let me first introduce Mr. Shiv Kumar to you. So Mr. Shiv Kumar Gopala has around 42 years of experience in strategy, operations, ERP, SAP consulting, and global program delivery. He has played key leadership roles in renowned organizations, focusing on revenue growth, customer engagement, and large-scale project execution. In his last corporate role, he has led global SAP practices at Tata Consultancy Services, driving business expansion across emerging market and ensuring top-tier service delivery. Prior to that, he played a pivotal role in setting up SAP practices, offshore delivery models, and competency centers, and delivering projects around 120 projects worldwide. Beyond IT, his experience span across sales, marketing, business consulting services, and in supply chain industry also, manufacturing, logistics, and material handling. Currently, he serves as an independent consultant, advising organization on strategy, operations, and digital transformation. So it's privileged to have you here.
Okay, thank you, Dr. Rupali. Thanks for the nice introductions. And I'll go on and introduce our technical partners representative, Mr. Satyanarayan Chebolu. Satya has been with Kripya Solution for quite some time. Of course, it's not a long stint, but prior to that, he's been with TCS, Wipro, Tech Mahindra, and lastly, I think he was with HCL. And he's been in the IT industry for quite some time, more than I think for about 3 decades now, and expert in manufacturing and in the IT industry verticals in terms of digital solutions, right? And then currently is a principal consultant for Kripya Solution. As you know, Kripya Solution is into IoT and digital engineering in a big way, and then they have offices in India and North America and Bangalore as well. And this has been an organization which is founded quite some time back, more than 30 years ago. Okay, they've been into IT services, have a lot of big logos, customer engagements, right? And currently, Satya is leading one of their verticals in manufacturing industry, and then where he is consulting on IT solution, IoT solutions, and digital engineering. Engineering degree, world mechanical engineer, and then also has a master's degree in aircraft production, having worked with HAL in his pre-IT days, right? And I welcome Satyanarayan to this panel discussion. And then he will be representing Kripya as a technical partner, and then he will take it forward in terms of his experience sharing and probably talk about some use cases, what could go into which industry and all that. So that will be really a kind of enlightening information for anybody in the MSME sector who is wanting to get into a digital transformation journey.
Thank you, Shiv
Yeah.
Kumar.
Thank you, Rabali. Yeah.
Thank you. So I'll introduce our industry expert, Mr. Rami Suri. He has around 20 years of experience across technology, telecommunication, engineering, manufacturing, and automation domain. And he has successfully managed customized business solutions for SCADA, ELV, HMI, embedded software and hardware, integrating both on premises and cloud-based implementation. He is also an entrepreneur. He has two companies. He is the co-founder and business head in Adaptive Informatics LLP and Triumph Technology, specializing in energy management and physical security solutions powered by AI and cloud technologies. He has successfully implemented IoT-driven patient management solution across global hospital Mumbai that enables seamless doctor-patient connectivity and digitalization of the records. He also serves as a growth and strategy business partner at Energy ETA and has an experience working in various organizations. Few of them is Samsung, Wipro, HCL Information Systems, and Honeywell. He is a mechanical engineer and a master's in business administration. He is also an IICA certified independent director. Glad, sir, you could join today.
Thank you, Rupali, for the introduction.
So now let me introduce the board member, Ms. Vijay Lakshmi Shankar. She is a vice president at Sri Ranga Polyester Private Limited. She has around 40 years of IT industry experience. For the first 15 years, she was associated with Stera as vice president and director of operations and solutioning, where she could set up multiple offshore delivery centers for clients across UK, Europe, and US. Her expertise span across research, innovation, product development, and she has worked with government, manufacturing sector, banking sector, and healthcare. And she has already played a key role in delivering complex IT projects and securing large contracts. She is a certified independent director, Industry 4.0 SSR, and additional certification she also has, which includes CISA, CQA, TIL, and PMP. She has led organizational transformation certifications. There are many. Few of them are ISO, CMM, TQM, SA 8000, and also she is into ESG reporting framework such as HIGG index, carbon emission reporting, and GRI reporting. Beyond IT, she is also passionate about teaching and serves as an adjunct faculty member in business school. She is an IIT Madras alumni, and she is a part of one of the startup initiative like PALS that aids around 40 engineering colleges in Tamil Nadu, Andhra Pradesh, and Telangana. Ma'am, we are excited to have you here and looking forward for the interactive session. Thank you all for joining the session. Shiva, the dais is all yours.
Thank you. As we all know, the topic for today's panel discussion is leveraging IT and digital engineering for innovative business model, right? And we are looking at a segment of industry which is MSME. I mean, the all over the world, especially in India, the MSME sector is the one which is a kind of a backbone for any industrial innovation, right? And then they are the pillars. Whatever you call it, the large enterprises, they depend on the MSMEs in terms of their supply chain components, right? And whether it is a service industry or it is a product-based industry, without MSME, nothing moves on in large enterprise segment, right? And then our focus as a BCI as a company, we've been focusing only on MSME because they are the people who are aspiring to go bigger in terms of revenue growth, in terms of market reach, in terms of new product development and all that. And that's what I thought probably the digital engineering plays a vital role in accelerating their growth journey. And then we are looking at 4 or 5 possible digital initiatives in any MSME industry. And then one of them is IoT and digital engineering, right? And then today we recommend, even though the automation has come into effect more than 3, 4, 4, or 5 decades ago, but automation over internet is something which has taken shape after IoT concept has been introduced in industries, right? And the fact that IoT plays a crucial role in collecting data from different sensors and transducers and actuators and all that, and then aggregating them in a kind of a data bank model, and then the data is being analyzed and then cleaned up and then being analyzed for any kind of decision making leadership wants to do, right? So that's how the architectural works in a typical IoT setup. And having said that, I think probably it will be good for all of us and also who are listening to this podcast to understand how it can help them in their digital journey, right? And that's what I thought probably we can give a kind of a brief introduction about the topic and also the purpose of the discussion. Then I can probably leave it to Rami. Rami, as Rupali had mentioned, comes from a kind of industry background where he has deployed IoT solutions in healthcare industries, right? So that's going to be a kind of experience sharing from Rami. And then taking a cue from there, I think probably Satyanarayan will be able to help us in terms of what else can go into a healthcare industry and also what else can go into other verticals, industry verticals like manufacturing, retail, pharma industries and all that, right? So over to Rami for your experience
Thanks.
sharing.
Thanks a lot, Shiva sir. I'll share my experience I had with a global hospital in Mumbai when I was with Samsung. I'll start with the problem statement first. The problem statement was like that the customer was looking for something which should be a solution which should be patient-centric. They had IT infrastructure, everything which was working for financials, working for backend options and all that. But ultimately, it is the hospitals work around the patient. Patient-centric, it should be patient-centric. They didn't have a solution. They asked us how we can help them. And Samsung also had an interest in selling their white goods like mobility devices, their LFDs, their TVs, and their ACs and all that stuff. Then we gave it a thought because they wanted some solution which could be around patient centric, wherein patient what his requirements are, how they're fulfilled, what is the resolution time for his grievance within the hospital and outside the hospital. And this was overall picture which they provided us, that they want a patient-centric solution. They have their ERP, everything working at the back end, the financial, everything working at the back end. Then when we entered the hospital, we had a thorough discussion for around a month with the teams, different teams, which are working like nursing staff, paramedical staff, with the staff which is managing other shows like catering and all that. They wanted a high-end kind of a hospital, which they could call it as a high-end hospital rather than a conventional hospital. We discussed all of them with the problem areas, and then we had an interaction with a couple of patients who were within the hospital, which we could interact. They were not probably in a stage of that they could not speak. We understood their problems. The first biggest issue challenge which we had faced, the patient was facing, was that they were not getting addressed. Their calls were not getting addressed. Like they initiated a conventional nurse call system. It was a mechanical, not a mechanical, electromechanical kind of a setup, wherein a patient presses a buzzer and the call is initiated at the nursing station, and she knows that this so and so bed number or patient number, whatever the designation is supposed to be addressed, and she used to go and close the issue, whatever the needful has to be done. But there was a biggest challenge: how much of a turnaround time and how much time the nurse used to take closing the call, and what she exactly did, what was the requirement, that was not recorded anywhere. The patient may had a requirement of having probably the nurse must have missed giving him a medicine, whatever time, it was a set time, but she was not doing it. That has had to be recorded, and they wanted to analyze the data, like Siva sir said, the data analysis. They wanted to analyze everything what is happening with the patient. So they give us a clue that they need something which wherein patient is, the data is collected, was nurse efficient enough to handle the solution, or whatever the requirement of the patient was. Then we thought it over it and we built up a solution. It was built in modules, not exactly in collectively modules. First, we started with the nurse management system, which we called as the nurse. The moment we used the solution in terms of, and we had mobility devices. We built up a UI specific for nurse calling management system, and the solution was running on Wi-Fi. The moment a device was given, a smart device was given to the patient or attendant, and same kind of a device running on Wi-Fi was placed at the nurse station. The moment the patient or the attendant initiated a call, that the signal or the intimation was given at the nursing station, and she got that so and so bed number is calling me, and she used to go there, and there is a Wi-Fi camera which recorded what the proceedings are happening. So in the meantime, whatever transaction, giving a patient an injection or whatever the needful was to be done, it was done, and it was recorded. How much time did she take and what time it recorded? Everything was recorded in a database. This was the first step which the hospital wanted to capture. Then they said, going further ahead, we want to integrate this system beyond with doctor management as well. We said, how? They said, whatever the doctor comes to the hospital, there's a chart or a board which is having some papers, documentation, and everything attached for the patient, and he prescribes whatever on the round, whatever has to be done. It should be digitized. It should be recorded, and it should go to the each and every level of patient record. And after the patient is discharged from the hospital, the record should be maintained. And if the patient is outside the hospital, even then if he accesses the doctor or calls the doctor on the visit or on the doctor within the premises of the hospital should have a record on his dashboard, what he had advised so and so did, and he can give him a kind of a treatment offline as well. This we did with the solution. We placed a tab which had a connectivity with the HIS of the hospital, and everything, whatever the doctor prescribed in every medicine or whatever this X-ray and everything, we had a facility of providing the DICOM images on the tab itself. And every data was available. The moment he entered the hospital or the patient room, he had access to each and every data, because there could have been multiple doctors which were on round. Someday for a month, there would have been some doctor, but he wasn't remembering that what he had prescribed other day. Sometime maybe in a month back or something like that, he could retrieve the data and accordingly initiate an action. This was within the premises. Then there was another requirement of the hospital. If the patient is discharged from the hospital and he needs a consultation with the doctor, but the doctor, he can call him up and the data is available to the doctor even if the doctor is outside the premises of the hospital. These were two modules which were initiated with them. Then there were other modules which they initiated, like integrating with the cafeteria management. The attendant or the patient needs some kind of a specialized food, beverage, or whatever it is, they can order on this, and that's connected with the billing system of the hospital. And gradually they built up a model. Different models were built on how the patient is made, and whatever the transaction with the patient is done, it is digitized, recorded, and can be retrieved at any moment of a time for analysis or for whatever the reason they wanted. This was this. And further going beyond that, they wanted, which was not implemented at that moment of time, it was under discussion. They wanted everything to be digitized in the room, from the perspective that if a patient or an attendant is within the hospital room, he is having these kind of solutions are to be provided with the high-end hospitals, not with the low-end hospitals. And he could manage his HVAC, where Samsung played a role. They had their HVAC solutions. He can connect it with the TV, or he can play some kind of an voice command or a UI using UI. He can utilize it as an entertainment source, and everything should be connected. And this should be recorded. Whatever the patient is doing within the hospital, this should be recorded and retrieved at any moment of a time. This was the solution which they needed. And beyond that, they asked us to do something tracking of the patient, wherein the patient is entering some X-ray area where he is exactly, because the attendant is most of the time nervous what is happening with the patient. He's gone for some test or something like within the premises, where he's located, how much time he will take, or he's connected with the staff, how much time he will take. He's having a smart device with him. He can speak to the concerned people and immediately get information. This was the whole scenario which was developed over a period of time, and there were pilot projects for different modules, and it was developed for over an year's time, 1 year time. And Samsung definitely had an interest of selling their own gadgets, devices, TVs, ACs, and all that stuff. This was the whole story.